A 65-year-old lady, a treated case of right breast cancer, now presenting with a mass in the left breast. The ultrasound and the mammography demonstrated a large mass in the left breast, which has solid and cystic components, and the fine needle aspiration cytology raised suspicion of a papillary neoplasm. So let's look at the images of the MR mammogram. The coronal stir images demonstrate fluid levels in a multiloculated cystic lesion with some areas of solid components. In the axial stir weighted images, you can see the fluid levels within the cystic component, and there is a solid component as well. It seems to involve some portions of the skin. If you look at the sagittal T2 weighted images, you can see the large mass that is occupying the breast, predominantly the upper quadrant. Some amount of vascular recruitment is also seen subjacent to it. If you're looking at the diffusion weighted imaging, nothing much remarkable. As we move on to the dynamic post-contrast images, you can clearly see that there is the cystic components with the fluid levels do not appear to demonstrate any sort of post-gadolinium enhancement, but there is an ill-defined solid component associated with this cystic multiloculated lesion. All these features, it extends up to the skin with some amount of asymmetric skin thickening of the breast and a solid early arterial enhancing solid component. Here we can see a solitary round lymph node in the axillary tail of the breast. If you look further up in the level 1 axillary station, we have a couple more round small lymph nodes. So these findings should point towards the fluid level in the cystic component probably represents hemorrhage, and of course the morphological features are typical of a malignancy in the opposite breast at a later date.